exciting presentation for you tonight. One of our favorites. We have Dr. Beljan try to come on every year. So before I introduce him, though, I just wanted to give you a couple of updates on our program. I'm Dina Davis, Director of Gifted for the district, and probably know a lot of your kids' names on rosters and on test scores, and maybe you by the phone. But I wanted to also introduce our testing coordinator / data tech, Deanna Sharverdian. So if you've got tests out there, results from outside testing, she's the one that you will, and she also coordinates all of our testing. So I also wanted to, speaking of testing, to say if you haven't yet had your child gifted tested and you are seeking outside testing, in addition to Dr. Beljan, on our PV Gifted website, we have a document there that says PV approved outside testers. And so we can't have testing just from anyone. We really need to have somebody that we're accustomed to their reports and their scores, and they're providing us the information that we need. I hate for you to get tested right, and then the test not be valid on the Arizona State approved test or something like that. So if you're looking for that, take a look on our website. We also have posted on the website a description of all our different gifted programs from preschool through high school. So take a look if you're looking to see something different or upcoming, or if your child progresses through we have a continuum of services, multiple different options at every grade level. So be sure to take a look at that. On the website, you'll also see that we have tours posted. We do the tours at the 5 schools that have the self-contained program. But we also look at the content replacement and cluster classrooms during those tours. So you're welcome to join us. There's no need to RSVP. You can just show up. Most of them are around 9 o'clock, 9:15, and we do them once per quarter. Another thing I should note is that our self-contained gifted program, that's the one that need applications, and those applications we're accepting them now throughout October if this is a school where you reside, and starting November 1st for any school that you would like in the district. As far as for the self-contained, we evaluate those once a month, so we'll collect them all in November, and then we'll evaluate them December 1st and let you know within a couple weeks. And it's the same thing as the testing. We do test throughout the year, our district testing, and the fall, we are doing just those who would qualify for pull-out for content replacement. In the spring is our massive testing, K6. So we start that actually in January. We call it spring, but it takes us that long to get through the district. So I think that's about it. Once you go through our website, if you have any questions, please call us and follow up. My admin assistant is Phaedra Begay, and either she or Deanna will be happy to help you. And so PV Gifted collaborates with UPC, United Parent Council, and has a gifted liaison. This is Marisha Garrity, and she and I work together to plan these parent nights for you. And she'll just tell you 1 minute about what PV, the UPC does, because there's a gifted parent group that you're invited to participate.
Hello everybody, I've been doing this for about 6 years now, almost 7 years. This will be my last year, and some other parent will be taking over my role. And what we're doing is we're partnering with the district on certain types of special areas, and gifted is one of them. We also have a special ed committee as well, and we have a new immersion committee, language immersion committee. And what these committees do is they partner with the district and whoever the subject matter expert is that manages that department, and we try to give feedback and input from our experiences with our children in the various programs. I have 4 children, one who is a graduate of the self-contained program, and I have 2 other kids that have gone through in the honor, they're gifted as well, identified as gifted through the honors pull-out program here in the district. So I just want to let you know that if you're interested or have any questions about the UPC, please see me. We have next month, we're going to have Dr. Laura Wingers, actually in December, because we're going to skip November. There's no program in November. In December 4th, we're going to have Dr. Laura Wingers come and talk to us about mindfulness. We have inside and outside speakers. And then I also want to tell you that at the UPC general meetings, those are once a month, we also have educational programs. This month's program and the meeting is tomorrow. The program starts at 10:15 a.m. Over in DAC. And the program is actually going to be Leah Knavely, and she is with the PBEA, and she's going to talk about what they're up to, which is the Paradise Valley Education Association. And the following in November's program is actually school resource officers. We have a program where we're going to bring in some resource officers and answer questions and kind of inform you on what school resource officers do in the district. And with that,
thank you. So, Dr. Paul Beljan is a colleague and friend. We've collaborated and gifted for many, many years. And he does a lot of our testing for gifted, for parents who want to seek something more than the district test can provide. So he does a lot for that. He's a pediatric neuropsychologist, speaks all over the world, and co-author of misdiagnosis and dual diagnosis of gifted children. And he's a protege of Dr. Webb's, who has also been a regular speaker with us. So I will just let him take over.
It's kind of funny the term protege, because Laura Winger, you should go to her lecture. She was a protege of mine, a student of mine, and was in my practice for about 10 years, and decided she needed to spread her wings. But for testing little guys under 6, she's really fantastic. I'm kind of advertising against my practice here, but that's how highly I think of her. So yeah, I wrote the misdiagnosis book and also large-scale brain systems and neuropsychological testing. So if you have a sleep disorder, that's a really great book to get. I'm going to talk about a whole bunch of different topics in gifted. Feel free to ask questions, try to keep to the topic. I'll talk about 45 minutes to an hour, and after that there'll be time for questions about your own child or something like that if you'd like. And then I can also stick around for folks who always want to stick around and ask their questions privately. So first what I'm going to do is give you a little bit of groundwork on the brain and how neuropsychology is very different than regular psychology. And kind of, if you infer from this, is why assessment is so important, especially I think with gifted kids, because it's so easy to misdiagnose them if you don't consider that high intellect. A way to think about that is if a child has a particularly low intellect, we certainly factor a lot about them in relationship to that. And it's no different when you have a very high IQ, that a lot of the behaviors that are normal for you may not be normal for the mainstream, and it's easy to pathologize those into something that could get misdiagnosed and medicated, ill-treated, and so on. So we don't want that to happen. Well, in neuropsychology, personality and behavior is driven by cognition, and we consider that all brain function is multiply determined. So the things I'm going to talk about are separate, but you have to think about them happening all at once. You know, even growing up, when people would say, oh, we only use 10% of our brain, and then there was a period of time where they said, oh, we only use 1/10 of 1% of our brain. And we said, that doesn't make much evolutional sense. We use all of our brain all the time, so it's important to understand it. Also, we're neither left nor right. This is a way overblown thing, and I throw this in there because it's kind of become a pet peeve of mine. Well, Timmy's very left brain or right brain. No, you're all brained. Okay, you can slant one way or the other a little bit, but still, everything is multiply determined. So a very simple way to understand the brain is back, middle, and front. So the back of the brain is occipital, temporal, and parietal lobes. Middle brain is limbic system, basal ganglia, and thalamus, hippocampus, all that nice meat down in there. And then the front is the frontal lobes. So the front is what's going to direct the brain, more or less. It's the operating system. The back of the brain, anything behind the frontal lobes and down low and medial, is collection system. What's out there? How many? Have you seen it before? And that information gets fed through the lower area of the brain, the limbic system, and all those structures. largely into the frontal lobe and higher cortex for decision making, how to start, how to persist, how to stop, things like that. So when you consider it this way, it makes a lot more sense than thinking about just a lobule of this or a lobule of that. Everything works together all at once. So asynchronous development is a great thing to understand in terms of gifted, because I think this is the leading thing that causes these children to be misdiagnosed with ADHD or OCD or bipolar disorder, different things like that. So asynchrony, everybody heard of this or a little bit? So it's a form of development in which there is a greater variability in skill set expression. So basically what it's saying is that nobody develops at this nice curve upwards. There's hits and jags to it and so on. But if you're gifted and you have some development that is just off the charts and other development that is average, high average, or superior, then it's going to look quite atypical to the other stuff that's off the charts. And you might say, well, that's abnormal, when in fact it may not be. Not everybody progresses at the same rate all the time. Some of the skills that lag behind others seem superior, or the others that seem superior. So the child might be frustrated with a skill set that lags behind. So right off the bat, you can see how something can lead to a misdiagnosis. If I'm a child and I can't draw a perfect circle because that's what I can see in my mind's eye, and I get frustrated by that, and then I start getting a little upset by other things that I can't do perfectly, and I become a bit of a little perfectionist, and you go to the wrong clinician and they say, well, your child must have OCD, we can medicate that. Well, high IQ, to me, in my experience of 30 years working with kids, almost suggests a bit of OCD. Doesn't mean you get the full-blown disorder. But if you ever met a physician, engineers, they just happen to like things at right angles, right? It just organizes the world better, and it helps things out better. It doesn't mean that they're going to flip out if it isn't that way, but it's preferable. And I just think that if the brighter you are, you lean that way. And for anybody who's been through grad school, if you didn't go in with OCD, you come out with it, because that's the way you succeed at it. So being frustrated and having this perfectionism can cause a lot of problems, but again, we always have to consider them germane to being a high IQ person and not something extra pathological, let's say. So will the skill sets that lag behind catch up? They generally do. I mean, not for everybody, but they generally will catch up. So for example, a good one that would catch up, the ability to inhibit sensory stimuli. There's a lot of kids that are diagnosed with sensory integration deficit, and they feel the tag on the back of their shirt, or I can feel the seams on my socks right now, things like that. Well, I'm an adult. I've got a pretty powerful set of frontal lobes, and that stuff is going to fall to the background of my attention because I can prioritize and allocate my attention where it needs to be. When I'm a child, my frontal lobes are not that powerful. My cingulate gyrus behind the frontal lobes that helps with inhibition, and so that stuff might be more at the forefront of my consciousness, and therefore it bothers me for a long period of time. Doesn't mean that it's a pathological disorder. In fact, what it might mean is that my sensory system is working really quite well, therefore I feel it, right? The integration part really has to do with, do I inhibit it, or can I prioritize my attention somewhere else? So we all see this in other aspects of our life. For instance, I only started going to movies again when they started having those bar loungers in there with wait staff, because it's silent, right? I can't inhibit the noise when people are talking at a theater, and I didn't go to movies for years. I'm ADD as all get out, so that's why I can't prioritize my attention off that. But the thing is that would be a typical adult kind of thing, but with a child, everything kind of sticks out more like a silver front tooth, right? Oh, it's atypical, therefore it's got to be a problem. But again, like I said, if you can feel that sensory system, it means your sensory system's working pretty darn good. So what happens if I put you on a sensory diet and take you to an OT or so on, and they teach us how to calm down, and deep hugs and back rubs and rabbit pelt rubs and all these things? Well, yeah, anybody's going to calm down if you do that to them, right? I'd like someone to rub my back with a rabbit pelt. It doesn't fix the problem, though. What it does is it soothes you in the moment, all right? But eventually the feeling or whatnot is going to come back. And part of the issue here then is one, you don't hear people say, you don't hear about adults with sensory integration deficit. Not really, right? And after, going to the OT for 8 years, and it worked. Well, no, it didn't work. The child's frontal lobes developed out of it, and now they naturally inhibit it. A good example of how the brain does something like this is your olfactory bulb. If you walk into a room and it's kind of stinky, it's going to be in your consciousness for a little bit, but that bulb will automatically equilibrate, and before you know it, you won't smell the smell. And this is kind of how it works with sensory systems as you get older. Unless it's something painful or whatnot, it's just going to fall to the background, but children don't do that as well. So again, skill sets lag behind others, but it doesn't mean that it's necessarily pathological. More on asynchrony. Some of the skill sets that lag behind that are pathologized are hardly fine motor, writing, numbers, pencil grip. This is a funny one because in later on in this lecture, there's a term base rates, and I like to think of things in terms of base rates. And given a certain population, what are the odds that a certain disorder would show up? So, for example, if the child doesn't have an in utero injury, a birth injury, a head injury, an anoxic injury, a seizure disorder, anything that would cause a fine motor deficit, then what are the odds of them having a fine motor deficit? Pretty small, right? Okay, so if I think about that and I can rule things out pretty fast, then it kind of opens up the door to, well, why does it look like a fine motor deficit? Well, a lot of gifted kids hate writing. Slower, they can't get their thoughts down as quickly, so they fight it. They don't want to do it, right? Well, if I fight it and I'm smart enough to get out of it, and a lot of them are, and I go keyboard or something like that, or I get my mom to transcribe for me, well, a couple things happen. One is I'm not practicing a skill set that needs to be practiced to habituate it to be able to do it without thinking. And that's the way writing has to get to be. By the same token, if I finally, after years of this, get forced to handwrite, well, if you go home and you have your old weightlifting kit and you do, 60 curls, and tomorrow your arms are going to hurt, right? That's natural. So if I force the child into using their hand and these new muscles, and they're going to say it hurts. Well, yeah, it hurts. You're working the muscle there. So again, it doesn't mean that it's hurting because of pathology. It's hurting because you're building something, but the child can't see it that way, and they'll argue it again in an egocentric way. The other way we look at this is, if the parent says that Timmy is gifted on the piano, odds are you don't have a fine motor deficit. So again, that handwriting problem is due to something else. If Timmy can build the Star Wars set out of Legos, not a fine motor deficit, right? So one funny little trick about fine motor and pencil grip and writing is, I don't know if everybody, maybe it's my age, but if they're still doing this, in kindergarten they used to have those big dumb red pencils that were really thick in your small hand, right? Now can you imagine, relatively speaking, using a writing instrument that big in your hand now? It's ludicrous, right? So the way to go is you have a little pencil for a little hand, and it has to be really short. Because if it's short enough that they have to pinch it here, then they can't rest it here, so they can't do a bad pencil grip. So they have to do a good tripod. It's just a nice little trick, little tiny pencil. Fine motor. Again, I see this on the level of a lot of kids simply are not out doing things. And this is an interesting one, gross motor, because I'm seeing this way outside the gifted population a lot more than what I used to, because we're at an age now where a lot of kids are just doing nothing but playing video games, and they're not out practicing gross motor skills, and they're just not that good at them. Language acumen over speech. A lot of times you get this pressured speech, and the child be referred to us with a stuttering problem or something because they're trying to tell you a story about their day, and they're like, and then, and they kind of get that, they're putting that bookmark there so they can stop and think about what they wanted to say, as opposed to, let me think about what I want to say, and now I'm going to tell you what I want to say, okay? So that kind of, how do I want to call it, jagged verbiage, for lack of another term, again, doesn't necessarily mean something that should be misdiagnosed. But let's say you're in class, and asynchrony also means that anything worth feeling is worth overfeeling, anything worth doing is worth overdoing. So these kids are intense. And I have my hand up to say the answer to the question, and I'm really intent about saying it, and I get excited. Well, what's going to happen? I didn't go into the full brain lecture, but what's going to happen is all this excitatory stimulus from my subcortical brain is going to come firing into my frontal lobes, okay? So the excitatory stimulus here is I've got the answer to the question. Stimulus from the subcortical brain comes into the frontal lobe, higher cortical brain as excitability. Now, if your little frontal lobes can't manage this tidal wave of excitability coming forward, you get disinhibited behavior. I'm gonna, right? You get stuck. Or you get disinhibited affect. You get overly upset when upset really isn't appropriate here. The cat's gonna be fine, that sort of thing. So again, it goes back to simple development. If in a smart brain, a lot more is going on subcortically that's automatic, then it would also suggest that a lot more gets to the frontal lobe that's automatic, that those little tiny frontal lobes aren't ready to handle, so they can't inhibit it, and they disinhibit it. It's normal for gifted. Hypersensitive to stimuli, kind of mentioned that. Low frustration tolerance, mentioned that. Can't execute what the mind's eye sees. It's funny to me how this one is really common except for handwriting. I don't know what it is on handwriting. So, skill sets that lag behind depend on frontal lobe mediation. Your frontal lobe's direct skills, more or less, and largely with your parietal lobe as well. It's important to know because it might be a predisposing factor into why so many of these kids get misdiagnosed with ADHD. If I'm bouncing in my seat, Miss Johnson, I've got the answer, or I just spit out the answer all the time, I'm looking pretty impulsive. I'm acting before I'm thinking. That's the definition of impulsive. If I'm up in my head thinking about, like Einstein, if I could ride my bike fast enough, would the light on my handlebars catch up with light and things go dark? You know what I mean? I'm not listening to what 8 times 4 is. Now there's these miraculous little guys that they'll ask them, what's 8 times 4? And they'll be like, 32, and go back to their thought. But to a teacher, when you think about it, they're not looking at the teacher, they look like they're off in space, literally. And what does that look like? Inattentiveness. When really they're being incredibly focused, but they're not prioritizing the focus on the right thing at the right time because they're a kid. So when you have this powerful brain that can do these things, kids aren't really good at putting limits on how they're going to do it. So the kid isn't going to be thinking, the 7-year-old, you know, I'm going to think about light when I get home. Right now I'm in school and it's more important to listen to 8 times 4. This is why you don't give a child an entire carton of ice cream, you give them a scoop. Because they wouldn't stop till they get sick. So to understand this, let's see, that's an old slide. More on asynchrony. So, well, I think this goes into it. I'm sorry, I haven't done this lecture in a while. If you look at an in utero brain, the way it develops is literally kind of this bottom-up kind of structure, and everything starts wrapping around, and the back is going to be your brain stem and your spine and forward, so everything's moving forward. So what's really growing first is subcortical functioning and deep limbic functioning, autonomic stuff. So at birth, that deep brain limbic system is up and running, right? It runs automatically. Now, I was lucky enough as an intern and a postdoc and at a hospital I used to work at, to work in the neonatology clinic. So I get to test thousands of babies with what's called a Bailey scale. These are like premature babies, and you serially test them to see if they're catching up to their chronological age or if they need more assistance. And the amazing thing is even a week-old baby, you can tell if they're really bright or if they're average, let's say, right? So if you can tell that, and there's no cognition on board yet, otherwise they'd come out talking, there's got to be something going on different very low in the brain that helps them pass these tests, which are basically stimulus response kinds of tests, all right? So, the higher cortex is going to continue to develop over time. So you can start to build your skills walking and so on and talking and all that sort of thing. But again, this subcortical cortex, or white matter and limbic matter, is often running by itself. So the idea here behind asynchrony is that there's something about that subcortical brain, mad, sad, glad, scared, feeding, fighting, fleeing, that is working incredibly more efficient, probably faster than the average child. Everything I just listed there are emotions. Little children are emotionally driven, and that's what gets fired into the frontal lobe as excitatory stimulus. But like I said, if you can't put a lid on your id, then all the behavior shows. And that's what happens to these gifted kids, and why They might even look like they have a diagnosis as ridiculous as bipolar disorder. It's funny, having been in mental health for around 30 years now, or at 34, you see cycling of disorders that get popular, usually based on the best-selling book. And about 10 years ago, bipolar was it. Diagnosis du jour, okay? You take a kid who does this kind of behavior, mad, sad, glad, scared, all day, every day, squared, right? And what are they going to look like? They're going to look like they're cycling, like they're manic or they're depressed or so on. And if they go to the wrong clinician who isn't versed and gifted or doesn't even consider some of those behaviors that they could be smart, and it's very easy to say, well, that's bipolar, because that is what bipolar looks like. So what would I do? I'd put them on the appropriate medication for bipolar, because I diagnosed it, and there's an appropriate medication to treat the symptoms. The mom comes back 2 weeks later, how's Timmy? Well, he's fine, he's really not doing much of anything, you know, because it's Tegretol or you know, one of these anti-seizure medications, mood stabilizers. And so what might happen is, and no dig on any shrink or physician in the room, even though I just said shrink, psychiatrist, is you can get a confirmatory bias without even knowing it. Well, I diagnosed it. I think my diagnosis is correct. The child had all the symptoms in the DSM-5. I made my diagnosis. I gave the appropriate medication. The symptoms went away. I was right. Kind of crazy, isn't it? So now, anybody know what the diagnosis du jour is now? No, ADHD is the gimme. It's always there. We'll always have ADHD. Autism spectrum disorder. I mean, even got the commercials of the rock stars. 1 in 166 children have this disorder. And a lot of gifted kids are kind of quirky. And if you look at what the diagnostic code is for autism spectrum disorder, it used to be about this wide, and with the new DSM-5, the Diagnostic Statistical Manual, it's this wide. So if you didn't have it 10 years ago, you got it now. It's insane, okay? They even took out, remember the disorder Asperger's disorder, which was kind of like autism light? That was taken out and subsumed under this other huge disorder. I am not a big conspiracy theorist, but I have a theory about why this exploded. And this exploded, I think, I have to look up the law. There was a law passed that forced insurance companies to reimburse treatment for autism. Do you know that? And before that, if you had a child with autism, you paid for those services out of pocket. They finally made a law against that. Then the disorder exploded, right? Because now we can diagnose it and get treatment if you're on the fence. But who writes the DSM-5? Psychiatry? Who gets most insurance dollars? Psychiatry. Who's going to treat it with medication? Psychiatry. It's kind of iffy as far as I'm concerned. But then again, maybe it's not a conspiracy. So in a smart baby, like I said, things are working faster in the subcortical brain, more efficiently, flexibly, adaptively, sensitively. And all of that goes to the frontal lobe. So the part of the brain that mediates the back of the brain. So let's do the poker analogy. It's a great way to think about how the front of your brain works with your subcortical brain, all right? Let's pretend that we're playing poker and you have $1,000 on the table. And I'll tell you a joke. Years ago I said, you have a straight flush. You draw into a straight flush. You have the best hand you could have. And this gifted kid, I swear, raised his hand. A royal flush is the best hand. So my opposition will still say you're a straight flush. Anyhow, so what's going to happen to your brain? You got $1,000 on the table. You just drew into a straight flush. You're going to make a ton of money. So what do?
Double down.
Yeah, poker face, right? You block your affect. You put a lid on your id. So all that excitement coming forward with your powerful adult frontal lobes, you can cut them off and just not change your affect one bit. Person thinks you're bluffing or you don't have anything, and you walk away with a lot of money. Okay? Now think about a gifted kid. Playing poker, we have 1,000 gummy bears on the table. The gifted kid draws into a royal flush. What's he gonna do? He's going to jump out of his skin, right? The same process is working in the brain, but that excited material coming forward, stimulus coming forward, overwhelms those frontal lobes, and they start giggling and moving in their seat and giving you a tell. He's got a good hand, I fold, right? So the child walks away with 1,000 instead of 10,000 and talks about it with their psychotherapist years later on the couch. But you get an idea of how this works and how that can lead to all kinds of problems in the population of professionals that don't know about this. Now, I keep saying that, but let me put it into context. Dr. Briz mentioned Dr. Jim Webb. Well, Jim Webb was one of the cornerstone thinkers in Gifted. And I was lucky enough that I went to graduate school where he taught. And in 1992, I got to take his Gifted elective course in my doctoral program. At that time, it was the only Gifted course you could take in the country. In 92, right? So by the time I was teaching, were you getting your master's or doctorate? Master's. There was a whole master's course in it, and Dina was in my class, and it was more widely known, but even still, physicians weren't getting it, psychiatry doesn't get it, family docs don't get it, pediatricians don't get it. When I went through postdoc and would teach residents and medical students, try to bring up Gifted, and I'd get the look, does it keep anybody alive? No, not really. Then I don't care, and they move on, right? And then I get a call once they get into residency. What's that thing you said about Gifted? Okay? So there's a massive population, most, that don't know about this, and therefore they are treating behaviors based on symptoms without thinking about what is the origin. And this is what neuropsychology does. Neuropsychology always looks at the origin. We don't look at outcomes. We look at what does it take in your head to produce what you're producing or not produce what you're producing, okay? It gives you much more insight on the child. So again, you can see how leading to too much medication. Let's say the child, a really bouncy, gifted kid who's just perky and fun and has all kinds of excited ideas and likes to share them and everything and doesn't listen to the teacher and so on, talks too much. Well, that sounds like ADHD, doesn't it? Okay, so I take that kid and I go to my family physician and Timmy seems like he has ADHD. So they give me a checklist called the Vanderbilt. It's like 25 questions that are true for you, me, and my Aunt Fanny. And the child comes out ADHD, and the doctor says, well, let's put him on a stimulant. Let's see if it works. It's gonna work. It's gonna work on almost anybody. If you ever look at the rates of stimulants working on people, your brain is designed for that. I mean, there's a lot of Starbucks in this country. So what's gonna happen again? I bring Timmy back. Is he doing all that stuff? No. He pulls the lint off of his pants a lot, but, he doesn't do the other stuff. Well, then I was right. He's on the right thing. But he doesn't have ADHD, so we just changed the trajectory of that child's life because we didn't take the time to do the due diligence and learn about Gifted and realize that some of those behaviors are actually kind of clever. So, in terms of our asynchronous, then, the Gifted back of the brain is a Ferrari and the frontal lobe is dune buggy. So it takes time for that frontal lobe and higher cortex to continue to myelinate and get thicker and more, I forget the term, hyperperfused, and have more and more power over the subcortical brain. And that takes a long time. They say your higher cortex doesn't even stop growing until about late 20s, some will say early 30s. Okay. So asynchronous, other kids don't understand them. So if adults don't understand them, other kids sure as heck don't. Kids have great awareness when they're gifted, and I think this is one of the biggest asynchronies that's overlooked, but they have terrible insight. So the 4-year-old gifted child can be aware that there's starvation in Yemen and be upset by that and choose not to eat their dinner because they don't have the insight to realize that that means nothing in relationship to their dinner. You know what I mean? So some of these kids can develop things like existential depression because they're looking at things and thinking about them without having the life experience to integrate them in a more healthy way. So it's important to kind of manage what kind of media and so on that they're exposing themselves to. And like it says at the bottom, and I was telling parents this the other day, you can't teach experience. This father was telling me about his 140 IQ son who's video game addicted. I mean addicted. And he says, I talked to him, and my answer is, you can't teach experience. You got to live experience. That it doesn't mean we're not going to do anything. We will. So, want to hear an interesting aside about the video games? I think this is interesting. Again, conspiracy theory, but it's actually true. If you think about addiction in a video game, and you have a child who's truly addicted that way, and you take away the game, they will act like someone who you just took their crap away. They'll tantrum, they'll flip out, they'll manipulate, they'll lie, they'll steal. They will do all kinds of behaviors that are not them to get that darn thing back. Okay, and once they have it back, right, they just, all the nucleus accumbens gets hit, and they just soothe like crazy. Well, the big companies that make these games hire neuroscientists to help design them to intermittently reinforce you, to get excited, to get a payoff, to get a hit into your nucleus accumbens, which is your reward center, which is where cocaine is going to work, so you get addicted to the game. Isn't that crazy? It's just like going to the casino and watching people dump nickel after nickel into the video poker machine and get an intermittent reward. It's not based on your poker ability, right? It's based on an algorithm. And the computer games are the same thing. So we got that to fight against with our kids. That's pretty tough.
Can I ask you one quick question?
Of course.
What about games 20 years ago?
I think your 20 is probably different than my 20. 20 years ago for me was Pong. When that came out. I think that at first there was a novelty about it, but then what kicked in more than the novelty is the intermittent reward. It's the most powerful reward out there. One of the things we talk about with parents a lot is that if your child is misbehaving, we look in, and I'm not a parent blamer, but some kids bring curveballs to good parenting. If the parents are inconsistent, and the kid says, can I 5 times, and on the 6th time I say, yeah, well, I just reinforce that, and that intermittent reinforcer is the most powerful one there is. So, I don't know if they were building it in back then. I don't think it took too long to figure it out. Because these, I mean, what's the latest one now? Fortnite, honestly called Frontline. Fortnite, a kid was describing it to me, and it's nothing but intermittent reward. But also, they hang this thing out to you of, yeah, but if you buy some coins or whatever and get the upgrade, you get more of a hit, right? Because you can do more now. So, it's pretty scary. So, any other questions right now? Neuropsychological issues.
I have a question.
Yeah.
So if possible accommodation for, say, math is a basic academy online, is that a bad idea then? Or some sort of math game, is that a bad idea if that's what you regularly use?
No, I don't think so. I think if a child has an issue with math, particularly in habituating math fundamentals, then I think it's appropriate for them to do a program like that where there are some built-in rewards. Because the difference to me in that scenario is you're rewarding the academic drive as opposed to the meaningless drive, right? The effort toward learning something versus the effort toward, you know, getting Mario a haircut. I don't know. You know what I
You
mean?
don't think there's a comparison?
I don't think so. No, if that's what it takes to get the kid to do the math, I think that's
Well,
probably.
like, as in the classes, if they're radically accelerated, that's kind of a solution.
I think that's awesome.
Okay.
Yeah.
Okay.
All right, some other behaviors that asynchrony might cause to look is inattentiveness, impulsivity, disinhibited behavior. Not being able to factor consequences into bad behavioral decisions. I remember for some reason, I was about 8, and I thought making a hangman's noose was really fascinating until I put it around the cat's leg and tied it to something, and the cat was freaking out. My mom was like, what kind of monster are you? So I wasn't considering the consequences of cutting off blood in the cat's foot. But it was okay, we cut it out. But if you act before you think, and you're into your little experiment, you don't think about the outcome, consequences simply don't occur to you. It doesn't necessarily mean that you're truly impulsive. Being stubborn. If I truly believe I'm right on something, or if I have this asynchrony towards fairness, and fairness is just the biggest, most important thing out there, except for when it applies to me, I'm going to be awfully stubborn. Learning disabilities. It's amazing to me that I still see articles that come out that are like shocked that learning disabilities can exist in a gifted child. Well, why wouldn't they exist in a gifted child? And I think that as far as being overdiagnosed, the problem here is this is way underdiagnosed, severely underdiagnosed. It's not uncommon for us to diagnose a kid with a learning disorder who has a 140 IQ, but their academics are at a 100 average. And I don't care about that score. My point is look at how the child's making errors. And if their errors are dyslexic type errors, that sort of thing, then they have the neuropsychological makeup that would produce a dyslexia. I don't care if they're functioning at 100, they should be functioning much higher. But the school will say, of course not PP, but the school will say, yeah, but that's fine. We got kids here that can't read at all. And this kid's reading average. It's no less a disorder. So listen, some other of these diagnoses. I mentioned earlier, I think differential diagnosing is really interesting because, again, having done this, there's a lot of typical cases that come to a private practice in neuropsych. I mean, I don't get the cool brain injury cases and things now and then, gunshot wounds, but you gotta be in the hospitals for those, but I don't like working for people, so I'm in private practice. So let's look at some of these. Short-term working memory deficit. So remember what I said about base rates. A short-term memory deficit means that what you encode doesn't stay, therefore it doesn't get into long-term memory, therefore you don't learn, okay? So working memory is the ability to hold 2 or more bits of information online in immediate memory and in the parietal lobe as well, and utilize that information together purposefully, right? It's how you self-direct. It's your psychological workbench. Well, I would contend that the smarter you are, the bigger your working memory, because you can factor more things together at one time and keep them all straight. And that's largely true in IQ testing. So if a parent of a 150 IQ child says, yeah, Timmy's got a short-term memory deficit, again, no birth injury, no neonatal injury, no head injury, blah, 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 what do you think the odds of that are? I mean, a short-term memory deficit means I give you a magazine, you read it, I give it to you again an hour later and you don't know you read it. That's a short-term memory deficit. So, why would a child look that way? Well, if the teacher is giving the math homework instructions and it's do page 37, do every other problem in the left-hand column, and I missed one word of that typed instruction, and I come home and my mom says, you got homework? Yeah, I got math. What do you got? I forget. Because if I was thinking again about light as opposed to math, what happened was I just didn't encode it. I remember what I remember. There's math homework, but I didn't encode the specifics. Therefore, as my child experienced, what am I going to say? I'm not going to say my attention drifted, because I don't know my attention drifts when it drifts. So I'm going to say, I don't remember. So I look like I have a memory deficit, when in fact, I didn't encode the information in the first place. Problem solved. $3,000. Processing speed deficit. This one is really ludicrous. If you're smart, you're quick. There's just no two ways about it. On the longer version of this lecture, there's a David Letterman slide from the, remember he used to do the top 10 list? And my favorite one of all time was, how do you know you have a dumb dog? And the number one was, there's a long delay between bow and wow. So that would be slow processing, right? So if the problem with this is nomenclature. On the Wechsler IQ test, most widely used IQ test in the world, there's a domain called processing speed, and it shouldn't be called that because it's got nothing to do with speed, really. There are 2 subtests in it. One is called symbol search, where it's just a simple cancellation task where you go as quickly as you can. The other is a coding task, where you're pairing a shape with a number repeatedly, okay? Well, let's think about this for a minute. A lot of gifted kids, this is their lowest domain. It's their lowest score. But what do we know about a lot of gifted kids? They hate to do pencil and paper stuff, right? They also might be a perfectionist and quadruple check. Am I right? Am I right? Am I right? That takes time. So what they get done is correct, but they don't get as much done as the next guy, so the score goes down. Doesn't mean they're slow. There's another test on the Wechsler test, which is called block design. On block design, you're simply putting blocks together to match a design that we show you on an easel. On that test, you can get bonus points for speed. And so the kids are going to fly on this thing. So when another professional says, well, Timmy has a processing speed, well, how is that possible? He got a 98 percentile on block design and earned 25 bonus points for speed. So you see how a lot of people just go by the title of something, they don't chew it up, and I'm talking professionals, PhDs, don't chew it up and break it down and think about anything beyond what they learn in grad school to say, well, that's kind of ridiculous. Here are bonus points over here. Or I did a language fluency test. I said, tell me all the animals you can think of in 1 minute. The kid gives me 50. That's pretty fast. So there's a very simple caveat in neuropsychology, and again, why you should take your child to a neuropsychologist for assessment as opposed to a regular psychologist, is you can't fake it if you don't have it, right? If I don't have memory, then out of 10 memory tests, if I do well on one, I don't have a memory deficit. If I do low on one speed test, but through the roof on another speed test, I don't have a speed problem. But a lot of people don't look at it that simply. So let's think about what would look like a speed problem. Come on, Timmy, it's time to put on or go to school, and Timmy still hasn't put his shoes on, right? Or he's loping behind me and thinking about something else, and before we get to the car, he disappears because he got his socks on backwards or something. That looks slow, but it's not slow because it's slow cognition. I've had other clinicians tell me, all right, well, if I ask Timmy, red and blue, how are they alike? And it takes 30 seconds to answer that, he's slow? Not necessarily, because if I ask Timmy, how'd you get at that answer? Well, first I was thinking about prime numbers, or prime colors, primary colors, I don't know how many colors. And I was thinking about if you blend red and blue, I think it's green, I'm not sure. But the bottom line is their colors. And that took 30 seconds to give me that answer, but look at how far all over the place they went before they gave it to me, you see? So again, it looks slow, but it's not slow. Auditory processing deficit, ever heard of this one? No? Okay, you? This one is way overdiagnosed. It means that you're not processing audition well. You're not processing audition well. I don't know how you would talk well, one. I don't know how you would get through your world well. Frequently what's going on in this is that if you have a child who is thinking of other things and not paying attention, they say, huh, a lot. So we start to think, that might be an auditory processing deficit. Or when they go to the movie, like me, they can't focus on the movie because everything else is distracting to them. That might be an auditory processing deficit. It's not. It's that they're not prioritizing their attention correctly yet. And it still doesn't even mean ADHD. You want to test for that. A good friend of mine is a speech-language pathologist, and we've gone round and round on this, and finally what we agreed on is this. The only time both of us ever see auditory processing deficit is when there's phonological dyslexia, and that would make sense. That you're not grasping or you haven't cracked the sound-symbol relationship, right, of phonics. That would be audition and how you're processing it. It takes multiple areas of the brain to do it. So this one is another one that you're rarely going to see. Sensory integration deficit we talked about, rabbit pelt. Oppositional defiant disorder. This is a great one. This is another one of these garbage kinetic diagnoses that you usually get from young professionals because you brought the child to me, he's got to have a disorder. So in oppositional defiant, the key to it is that you have a defiant child, but they do it in every environment. They do it at school, they do it to authority, they do it to parents, they'll do it to anybody, okay? They're just oppositional and defiant. I would contend that evolutionally speaking, you're not born that way, you're made, okay? Because evolutionally, it wouldn't make sense to be kind of a difficult person to deal with to your parents, because they're not gonna wanna feed you. If you're an infant. I mean, there's that thing about, it's so funny about how if you poke at a little baby's cheek and they go and goo at you and it just draws you in, you can't help it. I mean, it's evolutional, take care of it. So oppositional defiant, Well, if I'm a kid who questions things and I don't take things at face value, and the teacher says something that is historically incorrect from the books that I've been reading at home, I'm going to call her out on it. That could get called oppositional defiant. Or I'm not going to do 5 pages of multiplication because I get it, right? Everybody gets it, except 3 of the kids in class, and we're still going to do this and get timed on it. That's going to look oppositional, but it's not. Think of it this way. If a child has 2 parents or 1 parent at home that aren't drinking and drugging and beating on each other every night, they have a job, a warm house, a bed, 3 meals, snacks, hugs, I love yous, why would they be oppositional, right? So instead of blaming the child, and I just simply close the door on that, it opens up a lot of other doors of what it could be to explain this behavior without overly pathologizing the child, which is one of my main things I'm always careful about. So that right there is 45 minutes. I can go into some learning disorder stuff, or I can go into some behavioral management stuff, or I can open it up to questions. Anybody have any questions right now? Yeah.
So if you are concerned with like impulsivity or the child that can't control or doesn't understand consequences, without going to, oh, they've got ADHD, let's medicate them, how do we help them to make better choices? How do we help them to not be impulsive? How do we help them, guide them?
Okay, I don't know if anybody can hear that, but the question is how do you, one, maybe determine if the child truly has an impulse control problem? If they are impulsive, whether or not they have an impulse control deficit, how do you help them? Okay, so one is assessment. With a good neuropsychologist can definitively rule that in or rule that out. Every kid is impulsive. Their frontal lobes aren't developed yet. The question is it pathologically impulsive, right? They can't not do what they're thinking. So there's ways to test that in a standardized way. When you have your answer, that is going to more or less guide what to do about it, all right? To me, the key words are always these 3, but I've added one lately: structure, routine, consistency, and accountability. In other words, we take a top-down approach. You said the right word. What do? The child can't help it. And part of raising a child is constant teaching and discipline where necessary. This is going to sound funny, but I take a lot of my stuff out of dog training. And I love Labradors. And every Labrador I've had has never done anything wrong, ever. Never. Because if they did, it was because I gave them the opportunity to be a Labrador. Period. Right? And if I set up the environment to take away the opportunity for them to do inappropriate things because the Labrador doesn't have ill will, it just does what it does because it's stimulus bound and it's got a basal ganglia that big, then the environment is what controls for the behavior. Okay? So, for example, let's say I have a kid who's particularly impulsive and it's recess, and I'm the teacher. I'm going to always have that child at the end of the line before they go out to recess, and I'm going to stop them. What are you doing? What are you going to do? I don't know. Okay, you can do this or this. So I'm going to give them a forced choice. I'm going to limit it all the way down. If I go out on the playground and they're not doing one of those things, I'm going to say, Timmy, you can do this or this. If you don't pick one by the count of 3, I'm going to take you back to the room. Right? So I'm going to take away the opportunity for the failure as much as possible. Another way that I think about it is, I call it corral training. I've ridden 1 horse in my life, but I would imagine that if you're gonna train a horse, you're not gonna do it in the middle of a prairie, right? It's just gonna be a horse and run off. What you're gonna do is put it in a small corral, and you're gonna play with its face and play with its feet, because you gotta bridle it and shoe it, so it's gotta learn that, right? And I have it in a small enough corral that it can't jump and fail. So once it kind of gets to know me a little bit, I move it to the next big corral, and we'll work on some new things. If it fails here, we come back here. And we constantly expand and contract the corral. So I always feel sometimes I'm feeling like a cop-out because I might give you too many specifics. It's the idea that's the point. taking away the opportunity for the failure means success. And then intermittently testing, are you ready for the next step? Are you ready for the next step? But before you get ready for the next step, we're going to practice it in a smaller corral first. Is that a good answer? All right, yeah? And then, further than you. Yeah, you.
Oh, okay.
Thank
So how do you keep that, when you were speaking about that child who's distracted and thinking about Fortnite, when you're having a conversation about his impatience with math and that he can do it, he just doesn't have the patience for it, and he literally tells you, I'm sorry, what were you saying? I was thinking about Fortnite.
Mhm.
Like, how do you propose managing that, moving from elementary school to middle school, going from a self-contained gifted class to this larger environment, and how do you keep that corral managed and focused and make sure your child doesn't lose their, not necessarily love of learning because he's a minimalist, but not lose
Yeah.
complete interest in going
Right.
to school.
It's a
like,
pretty
say,
layered
9 to 5.
question. First of all, you said a key word in there, which is manage. My goal is to manage. I can't fix. If it's true blue, impulse control, inattention, I can't talk somebody out of a brain-based disorder. So again, I want to figure it out. Is this truly a brain-based disorder, or is this a gifted kid who has his mind in other places? That I can work with in therapy. I can correct that through a lot of different means, okay? I'm big on taking the chin. Look at me. I'm going to tell you something, right? I test kids all day, every day. I've got so many tricks I don't even remember what half of them are. I just do them, do over here, and get their attention, right? Repeat back to me what I'm going to say to you in your own words, so we're on the same page. And we're going to do that till you do it, right? Again, setting parameters, limiting the freedom to where they can succeed. The thing about, and also the caveat to all that is assessing first, is there a deficit or is there not? Because they're going to treat it differently. The thing about loving school or hating school, well, there's some key things about school and beliefs about gifted in school that I agree and don't agree with. For instance, one is repetition learning isn't necessary for a gifted child. I agree with that 50%. If you get the concept, right, move on. But if it's a skill that has to be consolidated, if that child can't do 8 times 7 as fast as I said, what's your name? I should get 56. Then you're practicing until you can do it. I don't care if you get it. It's not about getting it. It's about doing it and consolidating it into the cerebellum so it fires, okay? And here's why. Certain things like that, handwriting, spelling, reading, that's good enough, grammar. You're going to get graded on that, and where are you going to see it? On the first big grade of your life, the SATs. So if I'm gifted, and I can do all this whacked out math, right? But I got to stop and factor 8 times 7, plus 7, plus 7, plus 7. What are the odds that I get that right under the stress of an SAT? And 2, what are the odds I plug it into the right spot of a 6-step mathematical problem? As opposed to 8 times 7 is 56. Do you see? My error rate goes through the roof, and I wind up at Ohio State instead of Harvard. And anybody who goes to Ohio State, my apologies. But you get my point. Certain things have to be consolidated to the level of automaticity. Now, it's a cue-in also as to one of the major learning disorders that are the most undiagnosed ones there are, and that is a math fundamental consolidation learning disorder. So, if you do your multiplication tables, and you practice, and you get it, got it, right? You marched and did it, you bounced balls back and forth and did it, flashcards, whatever, okay? And we revisit it 6 months, and it's gone, well, 3 days, and it's gone, that's a math learning disorder, right there. Because it didn't consolidate the way it's supposed to. Once you've got it, you've got it. I mean, you don't have to think about how to drive the car every day that you drive the car. If you did, it would be awful. If you have to think about 8 times 7 every time you're going to do 8 times 7, it's awful, right? Now this is in the absence of a memory deficit. So it's not that you forgot what 8 times 7 is, it's that it didn't consolidate correctly because you have a learning disorder for that, so you have to figure it out. That will slow you down and ruin math for you. And I'm going off a tangent there, but math is so important. And people get deluded into, Timmy gets it, we can move on, as opposed to, no, he really doesn't get it. Or Timmy knows how to use spell check, we can move on. No, spell check makes a lot of mistakes. So habituation is a key thing in a lot of areas. You had a question, right?
No.
Didn't you have your hand up and I said her first?
She moved. No, I'm.
Oh, okay.
Mr. Sp-
Yes, sir.
No.
So, what's your take on brain scanning to identify, instead of just those regular assessment?
How many people are on Facebook watching this? I think the simple in-house, in-office brain scans are, frankly, junk science. You know, and I know as many people that would disagree with me as would totally disagree with me that are big-time world-renowned neuropsychologists. The science just isn't there yet. These people can make great arguments and explain things beautifully, but I don't think anything yet is a substitute for testing. Not yet. I'm not a fan. I don't think it's there yet.
But the testing is also very, you can tell how many people are testing and it's wrong results. You get testing at the doctor,
Yep.
and then you come back and you go to the school and they do another testing, and both of them they don't match.
And I can make the same.
In the middle.
I can make the same argument about the 4 different people administering the brain scanning and interpreting it differently. I can make the same argument. So the bottom line is it depends on who do you go to. There's snake oil salesmen, there's people who continue to read constantly after graduate school, and there's people who learned a few tricks and that's all they do. So I've said for a while, buyer beware, especially in areas of ADHD and gifted, because everybody and their mother wants to make money on your vulnerability. You know? So.
If I can add to what you're saying and kind of making decisions for
Speak
your
up a little
child.
bit.
Oh yeah, sorry. I just wanted to add what you're saying because you're wanting to be that advocate for your child and make the right decisions, and just like what Dr. Beljan was saying. And I had sort of a similar situation where my son I knew was not being challenged enough at his current school, and he was just a few percentage points off. And I knew there was something in him, and I said, okay, I'm going to go, Dr. Beljan, get the analysis, get it done, do the several hours of the IQ testing, and just like we was talking about that processing. My son's the perfectionist. His score was lower on processing because he was really making sure with his fancy little mechanical pencil that he brought in from his collection that, you know, the triangles were exactly perfect. So some scores were higher, some were lower, and he fell into this, what he said, like a really odd crack of the system.
A brain scan won't show you that.
Yeah, and exactly. So through all of this, I took what his letter was recommended, still wasn't quite accepted for honors, went back to the district. His IQ showed one thing, his percentage a different, and I just brought him today. He scored 100% on his Easy Merit test. Clearly my son can go into this class. Like, let's prove what it is. So we really do matter what you do as a parent, as the advocate, because if I just gave up months ago, I mean, he's so challenged now. So you have to go to the right people for sure. It's definitely.
You gotta shop around.
You really
it's
do.
buyer beware.
Yeah,
That's all I can
it's
say.
really frustrating.
Yeah.
So yeah.
Buyer beware. And you know, again, who has had coursework in it? Who has read books in it? Who's written books in it and stuff? You know, if I go to someone and I say, you know, what do you know about gifted? And they're like, well, it doesn't really mean much. Run screaming to somebody who thinks it does mean a lot. Because if that's the question about your child, you want an expert. Another question, sir.
Do you have any tips? You touched on this briefly with behavioral management of like if they, I don't know the right terminology, if they act out very defiant, or just any behavioral management, because I'm thinking from the parent, I know that I have sometimes, and I'll admit this, like low patience, like they start to get frustrated and yell, and then I don't handle it well. So is there advice that you have